Hi there and welcome back. Let's review gender dysphoria today. We'll get into the conceptual understanding of the medical term called gender dysphoria. We'll look into the symptoms, causes, treatment, the data that we have, and the bottom line underwriting. Gender dysphoria, formerly known as gender identity disorder, is defined by strong, persistent feelings of identification with the opposite gender and discomfort with one's own assigned sex that results in significant distress or impairment. People with gender dysphoria desire to live as members of the opposite sex and often dress and use mannerisms associated with the other gender. For instance, a person identified as a boy may feel and act like a girl. Children with gender dysphoria may manifest coexisting separation anxiety disorder, generalized anxiety disorder, and symptoms of depression. Adolescents are particularly at risk for depression and suicidal ideation and suicide attempts. Adults may display anxiety and depressive symptoms. Some adult males have a history of transvestic fetishism as well as other paraphilias. Associated personality disorders are more common among males than among females, being evaluated at adult gender clinics. So let's look at the symptoms. Children would express the desire to be the opposite sex, have disgust with their own genitals, believe that they will grow up to become the opposite sex, are rejected by their peer group and feel isolated, have anxiety and depression. Among the adults, the typical symptoms are desire to live as a person of the opposite sex, wish to be rid of their own genitals, dress in a way that is typical of the opposite sex, feel isolated, and of course have anxiety. So, what are the causes? The cause of gender dysphoria is unknown, but hormonal influences in the womb are suspected to be involved. The condition is rare and may occur in children or adults. There are no recent studies to provide data on prevalence of gender dysphoria. Data from some countries in Europe suggests that roughly 1 per 30,000 adult males and 1 per 100,000 adult females seek sex reassignment surgery. How this has been treated? Individual and family counseling is recommended for children and individual or couples therapy is recommended for adults. Sex reassignment through surgery and hormonal therapy is an option, but severe problems may persist after this form of treatment. A better outcome is associated with the early diagnosis and treatment. What about the mortality statistics from our standpoint for our purpose? Long-term mortality risk for female to male transition appears similar to that of women in the general population. Long-term mortality risk for male to female transition appears to be somewhat higher than general male population, likely reflective of a higher prevalence of comorbidities. For both female to male and male to female transitions, long-term mortality risk appears primarily related to comorbidities such as anxiety, depression, suicide risk, substance abuse, HIV disease, smoking, participation in risk-taking activities, and for male to female, to some minor degree, cardiovascular disease. Individuals who are not well followed medically and or who self-medicate may be at a significant risk of poor outcome. Transgender individuals require lifelong monitoring of cross-gender hormone levels to assure levels are within the physiological normal ranges, as well as routine screenings for familial and biological or natal gender risk factors. So how do we underwrite? Of course, we follow our company specifics and underwriting manual, but pay special attention to effect of disorder on social functioning, any associated mental disorder such as anxiety or depression, any record of suicide attempts or self-mutilation, any criminal record, and what are the favorable cases that we can identify. Those would be the cases where you would see that all planned gender affirming surgeries have been completed, appears well adjusted, pleased with the outcome, stable employment, home life, mild, none or resolved comorbid conditions, supportive social structure, and well followed medically, and you have a documented physiologically normal hormone levels, appropriate screenings for the natal and non-familial risks are performed from time to time. And if that is the case, then bottom line, you are looking at cases that you consider as being favorable. So, and again, bottom line, follow your company specifics and the underwriting manual that your company expects you to follow. And with that, let's stop here. That concludes the gender dysphoria, and hope to see you soon. Take care. Bye now.